everybody. Dr. Daniel here, and today I'm podcasting on how does migraine aggravate photophobia? Migraine headaches come with light sensitivity. How does migraine aggravate light sensitivity or photophobia is the question. Migraine affects the cranial nerves which carry the senses, such as vision, hearing, and olfaction. Persons with migraine are sensitive to light without headache, but especially sensitive during the time of their migraines. Migraine and photophobia. Photophobia phenotype is diverse. The relative contribution of the visual, trigeminal, and autonomic symptoms may depend on the disease it emerges from. In migraine, photophobia could result from photic activation of retina-driven pathways involved in the regulation of homeostasis, making its association with headache more complex than previously thought. So how does migraine aggravate photophobia? That migraine aggravates light sensitivity is true, but the way that it does it is still uncertain. Photophobia may result from photic activation of retina-driven pathways in an extremely complicated but not completely understood fashion. Related questions. What is the pathophysiology of migraine? Part of the reason for the connection between the two is that migraine is all associated with the altered processing of sensory stimuli like light. Migraine patients, called migraineurs, also have altered processing for auditory and olfactory sensory stimuli. Migraine patients are known to be, in general, always sensitive to light, even at normal times in between migraine attacks. It's been reported by Chong et al. In Cephalalgia on an article about interictal photosensitivity that patients with episodic migraine, which is defined as 14 or less headache days per month, have photosensitivity interictally, or as between attacks of migraine. These migraineurs have greater cortical thickness in the right parietal occipital and left frontoparietal regions, suggesting that persistent light sensitivity is associated with underlying structural alterations. Cortical thickness is reported, but exactly how that relates to photophobia is uncertain. Between migraine attacks, atypical sensory perception persists, with migraines often demonstrating low discomfort levels to variously experimentally applied stimuli. Studies need to figure out the pathophysiologic mechanism producing the sensitive migraineur's brain processing of sensory stimuli, both between and during migraine attacks. What are other causes of photophobia? Well, one is blepharospasm, which is an abnormal spasm causing blinking or sudden closure of the eyelids. Light sensitivity occurs with blepharospasm just like it does with migraine. It may come during an attack of migraine or in between attacks. It may be disabling. Migraine and blepharospasm are the two most common causes of photophobia. There are ocular causes of photophobia: dry eyes, iritis, uveitis, keratitis, conjunctivitis, wearing cataracts, ocular irritation such as produced by a traumatic scratch or blow to the eye, corneal abrasion, corneal neuropathy, cone dystrophies, retinitis pigmentosa, congenital glaucoma, or inherited degenerative retinal diseases. There are central nervous system disorders that can cause photophobia, such as subarachnoid hemorrhage from aneurysmal rupture, viral or bacterial meningitis, and pituitary tumors. Also, functional disorders can cause this. Persons with underlying psychiatric disorders such as depression, agoraphobia, anxiety, panic disorder, or bipolar disorder. How is the trigeminal nerve involved with photophobia? The fifth cranial nerve, the trigeminal nerve, carries fibers that go to the forehead and the cheek and the jaw area. And the first step in the migraine timing cycle is brain activation of pain fibers in the three branches of the trigeminal nerve. The trigeminal nerve carries fibers that go behind the eye and there, with arterial branches, cause pain behind one eye, which is a cardinal symptom of migraine. On my migraine blog at www.com Migraine.com, the opening picture is a woman with pain behind her right eye. And the word migraine comes from the Roman doctor Galen, living between the years 131 through 201, who wrote of a group of Romans who suffered with hemicrania, which means half of head. In later years, the term changed to hemicranium, hemigrania, migrania, migrana, migrum, and finally to migraine. The most common clinical feature of migraine is that it occurs on one side of the head and is present in about 80% of migraine patients. And the trigeminal nerve fibers project to the thalamus, the pain center of the brain and the midbrain. Is the retina involved with migraine and photophobia? Light comes into the eye via the pupil, impacts the retina, and leaves via the trigeminal through the optic nerve fibers. But how light becomes painful in the migraine-sensitive retina is the puzzle. The pupil is a circular opening into the eye that varies in size according to the amount of light which illuminates the retina. In a dark room, the pupil increases in size, but at the beach on a sunny day, the pupil constricts to limit the amount of light it lets in. After entering the eye, light passes through the lens, a protein-based jelly bean-like structure attached above and below by ligaments, which affords the ability to focus the eye to see near or far. With aging, the lens loses its flexibility and becomes hard, so it doesn't move well. And that's when you get old age eyes or presbyopia occurs, which is the phenomenon in middle age where one must hold the newspaper further out than usual to read the print. A humbling experience. Well treated by using glasses to help it. Light then reaches the retina where there are rod and cone cells. Rod cells are photoreceptor cells in the retina, which work in dim light. Rods are found at the outer edges of the retina and provide peripheral vision. The eye has 92 million rod cells which provide night vision, but not much color vision. Cone cells perceive light of different wavelengths and provide color vision. The eye has 6 to 7 million cone cells, which are in the center of the eye. Cone cells detect light and form vision such as reading letters or viewing images. The cones next project through the optic nerve to the center of the brain. Optic nerve signals travel around the pituitary gland and form the optic radiations, which pass through the temporal lobes to the back of the brain in the occipital cortex. It has been found, according to an article in the journal Neurosciences by Tiffany et al., that melanopsin cells, which are cells in the retina that sense light but don't provide vision, project to the thalamus and the midbrain also. These cells are thought to account for light-produced pain in blind persons with migraine. The melanopsin system doesn't provide form vision but can sense light. There are more cones than melanopsin cells in the eye, but once the cells turn on, they don't turn off. So the theory is that these melanopsin cells connect with the trigeminal nervous complex and the deep brain centers and provide a sense of brightness as related to pain. This may be the explanation for the uncomfortable light producing pain or photophobia with migraine, but more research needs to be done. What is the treatment of photophobia? Well, first idea, if it comes with migraine, treat migraine quickly. Rapid treatment of migraine, usually with a triptan at the onset of headache pain, will treat the headache and the photophobia also. Triptans are currently the go-to drugs for acute therapy of migraine. And in general, 80% of patients who treat their migraines at onset with a triptan are headache-free in 2 hours. Do dark glasses help? With migraine, the brighter the light, the more pain there is. Patients with migraine find extremely dark sunglasses that they'll wear during their migraines. Tinted lenses such as FL41 lenses reduce light sensitivity. Blocking blue light seems the most soothing to persons with light sensitivity. Studies done at King's College Hospital in London and the European Institute of Health and Medical Sciences found migraineurs especially sensitive to the red and blue light at either end of the spectrum. So filtering out the reds and blues through wearing especially developed migraine lenses can have a beneficial effect. Other studies have found that rose-tinted glasses helped children with migraine. The problem for chronic migraine patients is they may want to wear dark glasses all the time because they're over-treating with some painkiller, and photophobia is there all the time, just like the headache. These patients dim all lights and draw the shades and stay out of the light in their entire environment. A mistake, because chronic dark adaptation occurs, and then any light exposure is painful, and all light for them is perceived as brighter. The patient shouldn't always keep themselves in the dark, is the idea there. They should be counseled to not have darkened rooms, darkened windows, and to gradually increase the amount of light in their environment so they become more tolerant of light. Does light avoidance help or hinder? Migraine patients should not completely avoid light. That's impossible, but prudent exposure is suggested. Migraine patients should limit being out in the bright sun between noon and 4 p.m., which is the brightest time of day. Migraine patients may wear hats, particularly those with a baseball hat-type bill in front that blocks out light. They should also avoid flickering light. A patient told me years ago that a migraine started after she glanced out the window of her car while driving and saw the sun rising through a flickering light from a picket fence. The type of light that may bother migraine patients are flickering lights, glaring light, such as sunlight reflected on the ocean or standing water, fluorescent lights used at home or work, low-resolution computer screens, TV screens, patterns of light such as high-contrast checkered patterns or stripes. Does avoiding aggravating light sources help? Fluorescent lights, which emit a small flicker or light vibration, are notorious for aggravating migraine patients. I have written notes for patients' work supervisor advising turning down bright lights, removing fluorescent lights, allowing caps with bills, and the use of dark glasses or tinted glasses in my patients' work areas. CFL light bulbs save 2,000 times their weight in greenhouse gases and are an important part of energy efficiency and environmental care, yet they may aggravate migraines since these compact fluorescents can trigger migraines just as ordinary fluorescent lamps can. Migraine patients who work on desktop computers all day long often have light brightness or light flicker issues and need to change their work environment so they're more comfortable. Computer screen flicker can be adjusted by a technician to have static rather than flashing cursors. The computer screen should be placed away from the window to reduce glare. The patient should turn down the brightness of the screen and look away from the screen at regular intervals to give their eyes a rest. How does light sensitivity differ between normal persons and migraineurs? Migraine patients with photophobia have pain and discomfort at lower light levels than persons without migraine. Research has found that for persons without migraine, light becomes too bright when it reaches around 23,000 lux, which is equivalent to the amount of light on a bright, cloudless, sunny day. However, for migraine patients, level between 500 and 1,000 lux, such as may be found on a dull, overcast day, can be uncomfortable or produce pain. Is migraine a frequent medical problem? Migraine is a very frequent medical condition, especially for women. For women, migraine is the most common medical condition that women have. Migraine is more prevalent than hypertension, heart disease, arthritis, diabetes, or cancer. Migraine turns on or inflames the thalamus, which is the pain center deep in the middle of the brain. No other medical condition is known to activate or turn on the thalamus like migraine. Migraine also causes photophobia or light sensitivity, but the exact way it does it is not currently clear. Migraine in a headache practice. For over 35 years, I've seen headache patients in my office in Dallas, and migraine is a common medical problem. It affects 25% of women and 6% of men. Migraine is a disabling medical condition which causes severe, throbbing, one-sided headache, and migraine is the fifth most common disabling condition known to man. It's the 10th most common reason for a visit to the emergency room. Migraine is genetic. It's part of the patient's genome and in their DNA. The gene for migraine with and without aura and for hemiplegic migraine is known, has been published in medical journals. Migraine without aura and migraine with aura are inherited disorders. Persons with migraine who take triptans, opiate narcotics, or butalbital for headache more than 10 days a month may get medication to use headache, which should be avoided. When I try to examine someone with severe migraine or chronic migraine, and I look at their pupils with a bright light or try to look at their retina with a ophthalmoscope, they are resistant and blink and just move their head back and can't allow the examination. Photophobia means fear of light. And photophobia, the common clinical migraine situation, refers to the abnormal, uncomfortable, pain-producing sensitivity to light that migraine patients experience. Also, the International Classification of Headaches, so-called Bible of Headache Disorders, lists photophobia as one of the cardinal diagnostic features of migraine. Just being sensitive to light can indicate a migraine condition. Tension-type headaches, which is more prevalent than migraine, does not have sensitivity to light as a diagnostic symptom. Bright lights trigger or make existing headaches worse in 80% of migraine sufferers, and 98% of patients say that they can predict headache onset by light levels. So this is the end of my talk on how does migraine aggravate photophobia. Thank you for listening. Please click like down there and subscribe so we can follow each other. Follow me on podcasts for other talks I have on migraine. God bless all you folks with migraine. I will see you on the next talk.